National Assembly passed the National Health Insurance Bill last year. The ANC government says the NHI Bill seeks to provide universal access to healthcare services for all South Africans in accordance with the Constitution.
The aspiration to create an equitable and just health system has been part and parcel of our struggle for freedom and democracy.
Some advocacy groups say while they are in favor of universal access to quality health care for all, they are concerned that the NHI is being built on an already broken healthcare system.
So we are saying, honorable members, that we do understand some of the concerns about poor management, but we want to say to you that even in the overburdened public service, there are a lot of jewels, there are a lot of good performances across.
Business, civil society, organized labor, pharmaceutical companies and political parties attended public hearings to give their input on the bill, and a majority of the speakers agreed that universal access to quality health care should be available to all South Africans. However, they raised concern about how this will be achieved as proposed by the bill.
There is understandable and justifiable anxiety on the part of a number of stakeholders on how the NHI fund will be insulated against mismanagement, poor governance controls and corruption. A risk management framework will be developed in this regard.
The bill proposes, among other means of funding, a surcharge on personal income taxes.
Another concern is on the role of medical schemes under NHI. The state will be the sole purchaser of health services on behalf of users. Eligible users will not be able to opt out of the NHI or of paying the appropriate contributions.
In the long run, medical aids will just offer top-up cover for services and products not covered under the NHI. Most in the opposition benches did not support the bill.
Do not sell a dream to people. When you misdiagnose the problem, you will not find the correct cure. The cure is proper financial management and zero tolerance to corruption. However, that cannot be done until people like the former health minister is held accountable.
The NHI, contrary to popular belief, is far from what it is said to be. The NHI is not the eradication of a two-tier system. No, the NHI is true evidence, and the fact that the only way to eradicate a two-tier system is through nationalization.
The IFP made it clear that while it supports universal access to quality healthcare, it did not support the bill for various reasons.
We are of the considered opinion that the current form of the bill before the House today is not achievable. We state this for the following reason: affordability.
Government must take serious note that thousands of medical professionals will leave South Africa as the NHI is implemented, and that will leave South Africa in a serious crisis.
In the end, 205 members voted in favor of the NHI bill and 125 voted against it. Alris Mashaba, SABC News, Parliament.